Hi everyone. Now we are going to discuss about herpes simplex. Introduction. Herpes simplex is a common, acute and recurrent viral infection caused by the herpes simplex virus, which is also known as HSV. It mainly affects the skin and the mucous membrane and produces painful growth fluid-filled vesicles. After the primary infection, the virus remains latent in nerve cells and may reactivate later. Definition. Herpes simplex is a contagious viral disease caused by HSV1 or HSV2 characterized by recurrent painful vesicles and ulcers affecting the mouth, lips, genital region, skin, eyes, and sometimes the nervous system. The next we are going to discuss about the types of herpes simplex virus. Herpes simplex virus is commonly divided into two types, which is HSV1 and HSV2. In HSV1, it mainly causes oral herpes and the cold sores and eye infection are occurred. In HSV2, it mainly causes the genital herpes and also affects the genital areas. The next we are going to discuss about the transmission of herpes simplex. Herpes simplex spreads through direct contact with infected sores or secretions by kissing, sexual contact, contact with saliva, mother to child transmission during childbirth, and contact with infected skin even when visible sores are absent. The next we are going to discuss about the pathogenesis. The virus enters through a break in the skin or mucous membrane and multiplies locally. It then travels through sensory nerves and remains latent in sensory nerve ganglia. Reactivation may occur due to fever, stress, sunlight, fatigue, trauma, reduced immunity, and menstruation. The next we are going to discuss about the diagnosis of herpes simplex. Herpes simplex is diagnosed based on the clinical examination, PCR test which is highly sensitive, viral culture, smear and blood test for HSV antibodies. The next we are going to discuss about the treatment of herpes simplex. There is no complete cure that eliminates latent HSV, but antiviral medicines reduce symptoms and recurrence. Common antiviral drugs which includes acyclovir, valacyclovir, famciclovir. Supportive treatment includes analgesics for pain, adequate fluids, keeping affected areas clean and dry, avoid touching or scratching the lesions. The next we are going to discuss about the complications of herpes simplex. The complications are herpes keratitis, encephalitis, meningitis, neonatal herpes, secondary bacterial infection, recurrent painful lesions, severe infection in immunocompromised patients. Prevention. We have prevent the herpes simplex virus by avoid direct contact with the active lesions, avoid kissing during an active oral herpes or outbreak, practice safe sex and use condoms, avoid sharing personal items such as razors or lip products, maintain good hand hygiene, and in pregnant women with genital herpes should seek medical advice to reduce neonatal transmission. Thank you.